Assalamu alaikum.
Walaikum salam, Dr. Razak. How are you?
I'm fine. What about you?
Alhamdulillah, I'm very good.
Good.
Are you able to see me and hear me fine?
Yeah,
Is
yeah,
everything
yeah. I
okay?
can hear you properly.
Perfect.
Thank you so much for joining. Now I'm waiting.
Uh,
So, hello, Nishad.
Hi, how
Hi,
are
how
you?
are you? Fine.
I'm excellent.
Thank you so much for joining, and thank you so much for sparing your time. And
No,
I,
it's okay.
I know that it's not your like free time, but you at least manage it, and I'm highly
Sure.
grateful for that.
No
Right.
problem.
Yeah. Should we start?
Yeah, absolutely.
Yeah. I would like to start with introduction. My name is Dr. Abdurazak. I am Chevening Scholar for the cohort 2025-26. I am pursuing MSc in Public and Environmental Health Sciences from University of Birmingham. And I would like to request Nishat to self-introduce herself.
Yeah, hello. So my name is Nishad Maryam, and I'm a current Chevening scholar. I currently study at the SOAS University of London. I'm pursuing my master's in global development with the gender pathway, and I'm really excited to be here and would love to know about your experience further. Thank you.
Yeah, thank you so much. Imtiaz, would you like to start the interview? And yeah. So you will be given like 20 minutes, uh, 5 minutes for each part, like 5 minutes for the leadership, 5 minutes for the networking, 5 minutes for your course, and 5 minutes for your career plan. And I would like to request again to the Nishat to go ahead with her part like leadership and networking. Thank you.
Imtiaz, I'd like to ask you just one question. I'd like to know if you could elaborate on an incident where you had to face individuals who were not of the same opinion as you were. How did you convince them, and what were the results?
all right. Thank you so much, Dr. Abdul Razak and Nishad, for giving me this opportunity. And I would like to share the example and a situation where I was once in, where I had to like see myself in a leadership position. And it was back in 23 when I was organizing as a camp, and it was my role as an outreach coordinator for the camp, which we organized in a rural settings, particularly in the outreach of the Sakkar area where the rural health is very poor and people have very least access of the accessible healthcare. And the
Mhm.
major aim of the healthcare and the camp was for the ophthalmology, and it was for the cataract prevention and the surgeries that we were likely to perform and operate. So what happened was like I was the one who was organizing all the things because I was particularly working at a hospital which was mainly an ophthalmology hospital at Hajani Rasti Memorial Eye Hospital. So as we were seeing a lot of cases on a daily basis, so I convinced my team members and an organization, which is the Prevention and Cure of Blindness organization. Basically, it works all over the Sindh and Pakistan to operate on such issues where we help people prevent from blindness and some preventable illnesses that can help people. So I went to a village 2 days before the camp should be organized. So when I went there, I saw a lot of misconception and misinformation among the people. And as you asked me about the situation where I had to face the dislikes and the misconceptions and the misinformation from the people's end. So that was the situation, particularly I was involved. And it was really challenging for me as it was my first leadership role as well as my first outreach coordinator role. So I indulged into it by asking people, by knowing their problems. Like I tried to incorporate and involve with people in all the aspects. Like I talked to the people from the local leaderships, from the stakeholders who were involved, and from the women groups and the local public peoples who were there in the society of the rural Sindh where I was about to start the camp. So the major constituents and the major problems that they identified was that we don't get such opportunities or healthcare on an everyday basis. So what is it that you are bringing to us, and what hope are you going to bring with us, and how are you going to like manage this hope and will help us in the future by doing so. So I tried my best to explain to them that the problem is there. We understand about the problem. And this camp is actually identifying the gap and then helping to accelerate and find some solutions. Obviously, the health system and the public health system of Pakistan, and especially in the rural, the underprivileged areas of the Sindh, is very fragmented. So this was one of the gap that I identified. And then with the help of the people, the women's, because the women in rural population has a big role because they communicate a lot, they have a communication, because males mostly operate in the fields or the jobs, and the women are the people as a first person to be a clinician. And I see patients on a daily basis. So I'll give one additional context along with this example is that women are mostly the patients who bring their kids or themselves to the hospitals. So they were really interested in this opportunity and they were really wanting, okay, this will help us in the prevention. Then I explained what our purpose is, which was mainly to treat preventable eye diseases like cataract, to help people see, help with their vision. Because I believe personally, if a person can see, then he can perform all the jobs, then he can earn the bread and butter for his family. And that was the main objective. And with some religious leaders as well, I had some good communication and I tried to help them and understand the cause and the purpose of it. And that we just try to help as many people as we want to. These all factors combined was a very difficult situation, but it took me 2 days to communicate, to incorporate, to understand their point of view, their understandings, and then explain the procedure and the things that we were trying to help them with. And this was wholesome of a procedure. And afterwards, when we organized the camp on the third day, when our team arrived, I was involved with the logistics and everything. And successfully, we operated a camp for 1 day where we saw about 500 patients. We prevented 40 people from blindness by performing cataract surgeries, which is called phacoemulsification. And by seeing the impact, by seeing that they get the free medicines, the classes, and the change, and by getting them screened for the infectious diseases like hepatitis and the HIV, so that we can help them. So, as a whole, the reflection I got from this experience was that people have some misconceptions because of the fragmentation in the healthcare system and the public health in the Pakistan. But once we explain to them, talk to them, and the religious content, the people, the involvement along with the stakeholders, the local people, and listening to their concerns and perceptions is really an important task that I believe that was really helpful for me. And that has helped me in like successfully dealing with this situation.
Perfect. Thank you so much, Imtiaz. I would like to ask one more question on leadership and then just one on networking. So my other question from you would be, can you also tell me about a time when you experienced failure and how did you take that and what did you do in that situation?
Right. I faced failures over several times, but as a leader in a leadership role, there is a one instance that I remember very correctly. I had an opportunity to go for a training on international on integrated management of neonatal and child health illnesses. It was back in 24 when I was part of this training program organized by the Sindh government health department, and it was done at the National Institute of Child Health in Karachi. It was a 7 day program where we were taught how we can prevent the infant mortality and the mortality under the 5 years old children. So I was so enthusiastic and a young leader who was just saw that how we can prevent these illnesses. And after gaining the interactions from more than 30 to 35 leaders from all over this state from Sindh, so we tried to formulate certain plans and integrated them into a structure. And when I returned back to my workplace, I started a project. And it was basically a tri-age clinic setup within my own hospital at Rural Health Center Hospital, Toronaro. So this was my first of the most like impactful leadership role, I would say the initiative that I took on my own, like after getting some training. So when I started this tri-age clinic, I saw like there was so immense number of patients that were coming for this particular cause because I was the only doctor due to the resource limitations and the accessibility issues and the limitation of the tools. It was really difficult, and the most important part as well, that there was no proper way of integrating the data that we were gathering from all the cases that I was about to see. So I have managed to operate this triage clinic for about 1 month, and I set up a single room within my hospital where any patient who would come for a registration or treatment purpose, we used to see if he is under the 5 years of age, then he was supposed to see me as a Dr. Imtiaz who was operating on a tri-age clinic setup. So in this way, the good part of this initiative was that I was able to identify more than 100 cases of pneumonia, sepsis, and the serious bacterial infection, which were the main causes that we learned, and the data proves of the causes of the infant and the child mortality rate in Pakistan currently. I could identify those causes, but there was so limited access. There was crowded patient gatherings, as well as there were a lot of number of patients that I was unable to manage all those things as a single person or the single focal point. So this mission was not accomplished to the 100% of what I expected or what the goals I had in my mind. And I plan to keep this running for about a year, but unfortunately, due to the heavy influx of patient and the other operations of the hospitals were being disrupted due to this limited access to the pediatric patients, the hospital and the management asked me to convert this into the same old pattern that we were operating, like seeing all the patients together. So this was a time when I felt like, okay, like this system and this project did not go well. And it was kind of a, I took it as a failure, as well as I took some learnings from this project, that if I have the proper resources, if I have the manpower, if I have the trained staff, if I have the proper tools that I need, I can help prevent the mortality rate in under 5 children by implementing this triage clinic at any facility all over the sin. And one more additional factor that I can incorporate into this, which I gathered from my recent job that I am doing with a telehealth platform, and it's basically a platform that operates on a virtual basis, and it sees any patients from all over the world, and we can help them with the consultation, treatments, and all the things that they would require. And there are certain tools, and I can give you some examples, like Manchester University Hospital is using certain tools to analyze the X-rays, and it is incorporating the AI element into it, as we see that world is progressing so fast and using the technology into the healthcare. So when I reflected upon my journey and this procedure, this particular project and the failure causes, I came to know that there are certain things that if I get the chance, if I have those qualifications or the tools and the support, I can definitely get it into the working and make a better outcome of it.
Perfect. Thank you so much. My next question from you would be, can you let me know, how do you network?
All right. Uh, do you mind if I take a few sips of water before you can
Yeah,
continue?
sure. Of course.
Thank you. All right. All right. Nishat, can you repeat the question for me again?
Yes. My question is that, how do you network?
All right. So, networking for me has begun, I believe, long ago, because I am a person who have lived long way alone in hostels and have went out from my hometown, which is Toronaro village. I have moved from here when I was in sixth grade, and I have been living alone in hostel lives and like accommodating myself with for the education purpose. My educational journey is a long way from like sixth grade when I was about, I think, 13 years of age. And today I am 29 years of age. So I would say I have about 16 years of networking experience, which has taught me networking begins the moment when you are outside the home that you live. Like basically, you network within your home as well, but whenever you go out of your home, you start networking. But for this particular healthcare context, I would give few examples. I had an experience of working with very fine consultants and doctors all across the Pakistan, especially in the largest tertiary care hospitals, Karachi, which is Jinnah Postgraduate Medical Center. And it was catering about 3,000 patients in an emergency department every day. I had the chance to network with a lot of good consultants, doctors, patients, and the stakeholders over there. But when I returned to Pakistan, to my hometown, 2.5 years back when I was appointed as a government medical officer. And upon my return here, I have been a good friend and the networking skills that I operated with my friend and a mentor, Dr. Mir Mohammad Samejo. Now, let me tell you a brief about Dr. Mir Mohammad Samejo. Dr. Mir Mohammad Samejo is public health. He has completed his master's in public health. He has about 10 years of government medical officer experience and a good experience about 4 to 5 years of experience of working with vertical programs of the Sindh government, including the regional maternal and neonatal child health, the EPI, the expanded programs of immunizations, and the cataract and all the infectious disease protocols that the government operates within the Sindh and particularly within my district. So when I came in contact with Dr. Mir and the discussions and the workings enhanced, and especially when we were working on a measles campaign together in the region of our own Toronaro, it came to me and to him as well that we have a like-mindedness for the people of the underprivileged societies like ourselves in the Toronaro and the people who have not, who has the poor access to healthcare. So that was the point when I networked with him. And later on, we developed along the way because we shared the same values of improving the Sindh and the healthcare in the rural areas, especially the underprivileged areas, working on the similar public health domains like maternal and neonatal child health mortalities, the preventable illnesses, and all those factors. And due to our engagement, I have shared few sites from my end with him as well, which was few quality improvement projects that I have learned from the largest tertiary care hospitals and my urban experience. And he was really interested in knowing and improving the healthcare system within the uh, region that he was operating. And later, he has introduced me to various other campaigns and the people who are already working with the public health domain. So the most important one I would like to share about is the German society and the German, I would say an NGO. It was BMZ NGO that is operating within the Umarkot, and it is operating like within Pakistan entirely from since 2013. And we organized a camp together of plastic surgery. So it was organized in 2025, and we both were the focal point. And the person who further I networked with was the professor, Dr. Ashraf Ganatra, who is a very well-known plastic surgeon and the lead of the Al Mustafa Clinic that is operating independently now in the Karachi in relation with the BMZ group, which is a German group, and its other name is Deutsche Kleinhelfer, something like that, which basically operates on few domains. The mainly is for the cleft lip and the palate surgeries. And the importance is that they have, and the camp that we organized, me and Dr. Mir and the connections with the Dr. Ashraf Ganatra, and we had on call the video consultations with the German team and the few doctors. So we basically networked with globally. And for this particular cause, and how I was part of this, Dr. Mir introduced me that you are so much interested into the infant mortality and the child and maternal health care. So why don't you jump into this project and help us gather some information and help us along the way? So I said, definitely, like this is an opportunity that I was looking for. And it is a great step of networking as well. So when I moved into this camp, I will just give you a few numbers. Like we operated for about 1,300 surgeries, And these were 1,300 plastic surgeries for those people, especially the kids, who were unable to get the proper feeding mechanism because of the cleft lip or palate surgeries. So this was really an amazing experience. And I have networked through Dr. Mir within the district level as well as globally with different NGOs like the Gavi and UNICEF while working on measles, mumps, rubella procedures and the camps. And additionally, a recent campaign that was organized by Sindh Health Government Department on HPV, the human papilloma virus for the girls aged between 9 to 14. And me and Dr. Mir has been working and co-authoring a research on the prevalence, the social stigmas, and the aversions that were noted within the people of the age and within the localities about these vaccines. So, bringing my networking into this, like I have developed my networking from Dr. Mir within the district as well in the outreach and the globally. And thank you.
Perfect. Thank you so much. Raza, can we move towards the feedback on my part then?
Yeah, thank you so much, Nishad. It's now up to you. If you want to go with the feedback, it's okay. Otherwise, I should go with my part.
Honestly, I don't mind. I can stay.
Yeah,
So you can go ahead with your part.
yeah. Imtiaz, I'd like to ask only two questions. Number one, you chose London School of Hygiene and Tropical Medicine for MSc in Public Health. What specific module, the technical competency you think which will be offered at the London School of Hygiene and Tropical Medicine that you can't acquire within your country?
All right. So thank you so much, Razak, for this opportunity. And yes, my first choice and my most anticipated one was the MSc in Public Health for Global Practice at London School of Hygiene and Tropical Medicine. And the few motivations that I gathered from this course, in particular, was that this course is perfectly designed for the peoples of the low middle income countries and for the underprivileged societies like myself living within. And the society that I have identified the gaps and have been working for about 2.5 years, past 2.5 years. So I have seen some gaps and I have worked very closely with the people of the Masters in Public Health from Pakistan institutes like Dr. Mir Mohammad Samejo, one of the networks I have already mentioned. He is a public health scholar from Pakistan as well. So collectively, we have discussed a lot of issues that have been going on within the Pakistan healthcare and a lot of things that Pakistani and the Sindh government health has been working on, but due to some system and some fragmentation in the system, there were failures. Now, coming to the specific points of the course, I was really inspired, in particular, by the work of Professor Dr. Joy Lawn and her work on the infant mortality rate. And she has been publishing this work into a journal called The Lancet since 2013. And she is also working in association with WHO. And the three main targets that I was working on, the maternal and infant rate mortality, the LSHTM university, and this particular course has already been working on this and has been proven to improve the massively. The numbers speaks louder than what the volumes in Pakistan are. The second is the blindness and the prevention of blindness. And WHO has rated the research from LSHTM as one of the best, and they have been using that research in the cataract and the blindness purpose. And the third one is the TB and the preventable illness in the infectious part. That also LSHTM has proven to be the great numbers. And the particular course parts are the epidemiology, the health data analytics, and the research and the innovative ideas and the research networking that I can gain and learn from the LSHTM Institute is incomparable. And I cannot get those information or the level of that particular innovative and the research system from Pakistan that I can gather from the LSHTM. Additionally, given this platform of chevening and networking, I believe with the LSHTM knowledge, skills, and the tools and the research modules and the chevening networking, I can build up a better and a grooming and like flourishing system of public health in Pakistan, given within my career plan over the next 5 to 10 years.
Mm-hmm.
Thank you. My next question will be, your plan depends on the partnership with UNICEF, Gavi, NADRA, and FCDO-backed programs. How will your interventions remain sustainable if donor funding is decreased or stopped, or the political leadership is changed?
All right. So I will give a little background about the programs and the NGOs and the FCDOs that I have mentioned in my essays and the application as well, and the names you have suggested. So the Gavi, UNICEF, WHO, these are all the organizations that have already been working with the Sindh government health department. I can name various projects that we have been working on: the RMNCH, the MHCP, the EPI, the HPV, and all these other programs. These are already in place. But as we have found some gaps, and those programs are working on a, I would say, the models that are not completely resolving the issues, like the mortality rate has not been able to decrease. The HPV vaccine is unable to complete the 90% coverage that they were aiming, but they ended up with 34% of the coverage in their first trial. So there are things that I can relate with this, like the FCDOs that you mentioned. That political situation in Pakistan currently looks very stable, and given the government within the Sindh government, which is my immediate plan, like I have three things that I want to implement and go about in my career plan. Number one is a 1 year pilot project. And this 1 year pilot project involves only two groups of people, or the NGOs and their fundings and their help for me. The one is the Aga Khan Development Network and the research department. And how I can interconnect with that is by through my networking, because I have done a 1 year long internal medicine diploma course from Aga Khan. That was an online course. I have connected with more than 12 professors from their departments, and they have been the teacher for me. And I have learned from them that the research network in Pakistan from Aga Khan department in health sector is currently an amazing work they are doing, and they are really interested in partnership with any of the NGOs or any of the persons who is trying to improve the healthcare within the Sindh. So Aga Khan can be on board for my 1 year pilot project. And secondly, the Sindh government itself, as I am a government employee, I can present them this 1 year pilot project, and they can help me with incorporating this project within the same system that is already operating. Now, definitely this question comes in mind, that if there is a system already in place, then how my pilot project is different. My pilot project is different on three different things. My pilot project aims to reduce the maternal and neonatal mortality, prevent illnesses that are preventable, like cataract and the infectious diseases, and digitization of the healthcare in Sindh and Pakistan. So the digitization can be done easily with Nadra, and I have one good example: the Sehat Kahani app that has been completely operable in Pakistan, though it does not cover a lot of population, but it has shown to cover sufficient amount within a short span of time that it has begun and operating in Pakistan. So yes, there are certain examples that health can be digitalized in Pakistan, and Nadra can play a big role because everybody has an identity document, and everybody. And one more example that I can recall is the Mamta program, which is basically to improve the transportation, the nutrition, and those costs. And the government pays bills and gives money to the women who are pregnant on their pregnancy based 5,000 to 10,000 rupees in PKR, to help with the child's nutrition, to help with their transport, to make them come for their regular antenatal checkups and their investigations. So I can interconnect all these budgets and fundings into a digital system where my 1 year pilot project will work. And with digitalization and NADRA incorporation, we can also improve the EPI, the vaccines for the polio and other, which is currently at 65% in the rural Sindh. And I can increase the coverage up to 85% by implementing these all changes. And I'm sorry, but I forgot about the second part of your question. If you could repeat, I'll try to help and answer that.
Razak, you're on mute. Razak, you are on mute. We cannot hear you.
Oh, I'm
Yeah,
sorry.
now good.
Yeah. Uh, my question was that if donor funding is decreased, our political leadership is changed. That was the second one. But I think we are running out of time, so it's good that we
Well,
should give like feedback. It will be great for
I
you.
would just two more lines into this
Yeah, please,
answer.
please. Yeah.
All right. So the political situation may change and the fundings may reduce, but my 1 year pilot project that is completely independent of a heavy funding, I would like to introduce that 1 year pilot project as my portfolio to show the government and the FCDOs and the NGOs that these are the results that I'm aiming to obtain. And I'm very confident that with these integration of these three systems and the three M's that I have mentioned, I can gain and gather up the material, the data, and the research, and the figures will help me improve a lot. And those numbers will automatically help me gain the fundings for the next projects of my 5 year plan.
Mm.
Yeah,
Thank you.
great. Thank you, Imtiaz. Nishad, now can you please give feedback on your part? Thank you.
Perfect. So in that, I hope that you know that when you appear for the interview, you should always be dressed extremely formal. So make sure you definitely do that. That would be my first point. But other than that, I think you showed like excellent demonstration of like using the STAR method. Like you clearly laid out all the situation, the tasks, the activities, and even you concluded with repeating some of those. So that was a very good point. Something that I would still request you to work on would be a little bit of time management and also streamlining some of your answers because I understand you were using the STAR method, but there was so much information that at times I was getting lost initially. So just make sure that these are some good points, some valid points that you're putting out instead of like all the information. That was just my initial thoughts on the leadership part, but I do have a lot of feedback on the networking part. So basically, my question to you was, how do you network? That was a bit different from what you answered. Basically, how do you network would be that what is the procedure that you use? What are some of the steps that you use to network? I was looking for that explanation, and then you could pivot or and give some example. You did that a little bit differently. A lot of times we do get confused or intimidated when a question is asked, and we immediately try to answer it. So it's very nice that you listen and give yourself a moment, pause a little bit, or even like grab a glass of water and just process what the question is and then start working on it. I absolutely have confidence that you would have answered the question the way I wanted it to, but you just wanted to answer it, so you just jumped right into the networking answer. So again, you started with a very good, strong sort of initiation where you mentioned that you've been networking for 16 years. That was excellent. You could have gone on by saying that, oh, I network, that I reach out to people who are like minded or not like minded. I initiate conversations with them. I make sure that I ask about their interests or how their interests align with mine. And then you could also say that I definitely take their contact number and I reach out to them afterwards just to stay in contact and then also connect with them on LinkedIn. And then you could give an example of how you've done that practically. Other something else that I wanted to put out was also that the answer became very, very long. So make sure you make it concise. And you also, I think, forgot a name and you said something like that. So if you don't know something, do not bring it up because that would give like a negative impact to the panel. Other than that, a lot of your networking answer was like, through Dr. Mir, I learned this, or through Dr. Mir, networking, came to you. Do not show that. You are the highlight. You need to talk about yourself a lot more than that. And also always use formal language. I think you used the word gonna, I'm gonna do this. Do not use that. That would that really sounds informal. But other than that, I think this is a great attempt. I would highly recommend that you make your answers a bit more concise. Thank you.
Thank you so
Thank you
much,
so much.
Nishad, for your constructive feedback. My feedback are also more or less similar to yours. I would suggest that be natural and don't look like robotic. and you don't need to perform. You just present your case, and what you speak that should be like matching with your like facial expressions, and behave humanly. Like it's not like you are always looking on the screen. You can move, you can like do like this. This is a natural human tone, and you can mumble because English is not our formal language, so it's completely fine. Regarding questions, like my first question was about the course. So you should remain specific on that, that this specific module, which is taught in MSc in Public Health in LSHTM, and that is much more appealing, and that matches with my career plan like this. So be specific rather than giving the general statements. And about the second question, just give the I asked that if donor funding is decreased or if political leadership is changed, what will you do? Your response was totally different. You should give like plan B, or the contingency plan. What will be the your contingency plan, and be straightforward, and try to give like response as short as possible, but that response should be clear, comprehensive, and concise. And the information you are giving, that must be accurate information. Like you said that there is a program in Sindh and Pakistan, Benazir Nasho Nema program, that provides, like you said, that 5,000 to 10,000 to the families, but actually they are providing $10 to the male baby and $15 to the female baby. So it's not about like 10,000. It will not. So whatsoever the information you are giving, that should be the correct information. And another thing, like the language or jargons or medical language, you try to avoid uh, too much that language, because uh, you can expect the person who may not be friendly with medical terms. So that's what my feedback was. But overall, that was fantastic, and that's your first time. I hope you will work on all these things.
Yeah,
And
you did great.
Any other thing if you want to ask or if you want to mention?
I have no, no. Thank you so much. Like this is something like I would call it like it's my first encounter of a
Yeah.
practice, and I was actually researching a lot on the data, and that I can relate myself from speaking with you guys like that. I have omitted out a lot of data, but not integrated them into a proper way and a proper concise manner, which I believe I'll have to do and work on. And secondly, Nishat, I have a follow-up thing to ask from your question, because I think I was interrupted in between. My network was interrupted while we were speaking on the networking. You mentioned that I can mention about networking. My start was good, about 16 years of networking, and how I can start by like using the internet from interest with the people of the same likings and the minded people, and the context that we can exchange, the LinkedIn we can use, and socials that we can connect with. And the next part about that, like I just completely lost because of the internet. And second thing I just want to add up to this was I have also been part of another scholarship program back in 2019, which was the SUSI exchange program for the US exchange program. It was
Hmm.
basically a leadership program at University of Massachusetts, and I was there for 6 weeks. And it was one of the great and life-changing networking programs that I had for me. So, but I haven't mentioned this in my essays, and I'm trying to like keep it away from the discussion. But I believe that for the networking part, if I need to add up something, that would help me a lot. If you agree with that.
Honestly, so your interview is basically you telling the panel what you want to tell them. So if Susie is a big achievement for you, you can absolutely steer the conversation towards that side, because that's what I did. Whatever I wanted them to know, I strategically placed it in all my questions. Like bit by bit, I was dropping crumbs in between that. Oh, I've also done this and I've worked with Harvard. So it really gives a really good impact. Other than that, for networking, make sure that you lay out the procedure first and then give an example. Maybe you could say that you found out through a conversation about Susie Susie. You had a conversation with somebody, a colleague or somebody in your circle. You had a conversation with them, and they told you about Susie, and they guided you, and that's how you ended up getting this scholarship in the end. Applying
Thank,
and then getting it.
thank you, Nishad.
Yeah.
We are going out of time, like 2 seconds are